Today we are diving deep into a truly bewildering condition that really pushes the boundaries of how we understand pain. It's called Complex Regional Pain Syndrome, or CRPS. And with CRPS, the intense connection between physical agony and a person's psychological state isn't just a side effect of the disease. In many ways, it is the disease.
So let's just think about that for a second. What if pain wasn't just a simple message telling you, ouch, that's hot, or hey, you sprained your ankle? What if the pain itself could get into your brain's command center and start flipping switches, changing the wiring, and fundamentally altering how you perceive your own body? Well, that is the baffling reality for people living with CRPS.
All right, so first things first. Let's really get a handle on what CRPS is, because understanding it means seeing just how different it is from the normal pain we've all felt at some point.
At its core, CRPS is a chronic pain condition where the pain signals are turned up to 11. We're talking about severe, burning, unrelenting pain that is just wildly out of proportion to the original injury. And sometimes, that injury could be something as minor as a small sprain, a little cut, or a routine surgery. The response just doesn't match the cause.
And the symptoms, they are intense, and you can often literally see them. There's something called allodynia, which means that the gentle brush of a cotton ball or a bed sheet can cause absolute agony. Then there's hyperalgesia, where a tiny pinprick feels like a major wound. On top of that, you see these bizarre physical changes. The affected limb can swell up, the skin might turn blotchy purple or fiery red, and it can feel ice cold or burning hot to the touch. It can even change how hair and nails grow on that one part of the body.
But believe it or not, those physical signs are really just the surface of the problem. To truly get what's going on with CRPS, we have to go deeper, inside the nervous system itself, to see how the whole communication network just goes completely haywire.
And that brings us to this critical idea, central sensitization. The best way to think about it is like this. Imagine your body's alarm system is broken. It's like a car alarm that's way too sensitive. It goes off not just for a break-in, but for a gust of wind or a single raindrop. And once it starts blaring, you can't turn it off. That's the nervous system in CRPS. It gets stuck in this state of high alert, amplifying every little signal into a massive pain siren.
Okay, this is where it gets really, really weird. Your brain has this internal map of your body, right? It's how it knows where your hands and feet are. In CRPS, that map gets corrupted. The part of the brain that represents the painful limb can actually shrink. Patients start to feel like their own arm or leg is a foreign object, like it doesn't belong to them anymore. They might not be able to tell which finger you're touching without looking. Some can't even tell if a picture is of a left hand or a right hand. This is so much more than pain. It's a complete scrambling of the brain's sense of self.
And that's because pain is not a one-way street from your body up to your brain. It's a constant two-way conversation. You have the bottom-up signals, the raw data from an injury traveling to the brain. But you also have top-down processing. This is your brain's beliefs, fears, and expectations traveling down and changing how you perceive those signals. With CRPS, the brain starts to predict pain. It gets so good at it that it starts to create and amplify the sensation all on its own.
Now, all of this neurological chaos kicks off a truly vicious cycle. And it's right here, in this feedback loop, that we see how psychological factors aren't just a consequence of the pain, they become a powerful engine that actually drives it.
And the psychological toll is just immense. I mean, look at these numbers. A staggering 60% of CRPS patients suffer from depression. That's way higher than what you see in other chronic pain conditions. And the link with anxiety is a two-way street. Not only does living with this pain cause anxiety, but some research even suggests that if you have pre-existing anxiety, you might be more vulnerable to developing CRPS after an injury.
And this all feeds into a devastating cycle. Here's how it works. It starts with the intense physical pain. That pain, naturally, leads to fear. Fear of moving it, fear of making it worse, and this catastrophic thinking that the pain is a permanent disaster. That fear leads to avoidance. You stop using the limb. But that disuse has real physical consequences, like muscle wasting and even more sensitivity. And what does that do? It cranks up the pain, which starts the whole horrible cycle all over again.
The weight of being trapped in this loop is just crushing. To put it in the starkest terms possible, look at this number.
In one survey, nearly half of CRPS patients reported having suicidal thoughts. That statistic right there shows you that treating the mind in this condition isn't just helpful, it is absolutely life-saving.
But this is where the story takes a turn, because if the brain can be rewired to create so much suffering, it also means it has the capacity to be rewired for healing. That same neuroplasticity, that ability to change, which causes the problem, well, that can also be the solution.
So this completely reframes how we should think about psychological therapy for CRPS. This isn't just about learning to cope or managing your feelings. No way. It's an active treatment. These therapies are tools designed to physically change the brain, to calm that overactive nervous system, and to literally retrain its perception of pain.
And there are a few really powerful ways to do this. You've got cognitive behavioral therapy, or CBT, which directly tackles those catastrophic thoughts that fuel the pain cycle. Then there's acceptance and commitment therapy, or ACT, which teaches a different approach. Accept the difficult feelings instead of fighting them, and focus your energy on living a full life. And then there's mindfulness, which helps you observe sensations without panicking, breaking that automatic link between a feeling and a fearful reaction.
Of course, it goes beyond just formal therapy sessions. Recovery is also about building what we call psychological resilience. This is about actively cultivating things like optimism and a sense of purpose. It's about practicing acceptance to reduce that mental tug-of-war with the pain. It's about building self-efficacy, that rock-solid belief in your own ability to manage things. And of course, nurturing those all-important social connections.
And that brings us to what might be the single most important takeaway from all of this. For a condition like CRPS, treating the mind isn't a secondary issue. It's not an add-on you get to later. Early psychological help is a primary, frontline preventative strategy. It can stop that vicious cycle from ever gaining momentum and can literally change the entire course of the disease.
So we're left with this final, really powerful question. CRPS shows us the brain's terrifying and incredible ability to learn pain, to wire it so deeply into its very structure. But if that's true, it also opens up this incredibly hopeful possibility that the brain, with the right tools and the right understanding, can also be taught to unlearn it. It can be taught to heal itself.